This week on Innovations in Medicine, the newest research on whether it's safe to use cannabis if you're pregnant.
THC gets into the maternal bloodstream, which then transfers it to the baby's bloodstream.
Next, people can have complaints of not feeling well, but some people have a condition that can seriously affect their lives.
Hypochondria, or illness and anxiety disorder, can be successfully treated. There is hope.
Also, lung cancer is the leading cause of cancer deaths in the nation. A thoracic surgeon reveals the importance of regular screening if you are at risk.
Everyone who is an active smoker or fits the criteria should get a low-dose CAT scan of the chest, because by the time you have symptoms, it's too late.
Then, which diet is the best to help you feel better and live healthier?
The most sensible way to lose weight is to lose the weight long term.
Later, a look into how neurosurgery is changing the lives of people with crippling back pain.
Sometimes people will have massive amounts of compression of their spinal cord or nerves and they present to the emergency room. Other patients may have a progressive course that can go on for a year or two.
And finally, how a hip replacement can transform a person's life.
They went from being very, very depressed to being one of the happiest patients I've ever treated.
This week on Innovations in Medicine. Marijuana smoke has many of the same chemicals as tobacco smoke and may increase the chances for developmental problems in your baby. Dr. Helen Rodriguez, who specializes in obstetrics and gynecology, talks about the dangers of using cannabis during pregnancy.
Cannabis has a lot of chemicals in it, really, the most active of which is the THC. That is the one that gives you the high, just as it has effect on the adult brain or the person that might be, the mother that may be smoking. It also gets into the maternal bloodstream, which then transfers it to the baby's bloodstream. And so it has significant effects also on the baby's neurological makeup. The baby's brain that is growing also is exposed to the THC.
There is evidence of serious consequences to the baby from THC exposure.
More babies deliver prematurely. We have more babies that are smaller when they're born than those that have not been exposed to maternal cannabis exposure. Also, sometimes the babies are more fidgety, like they're missing something, so they're more restless when they're born. And now there's some data that shows that they actually don't do quite as well in the early years of schooling. They don't really appear to have as much ability to concentrate, so they're more distractible. So when you're not able to concentrate, you don't learn as well. So those are some of the things that are being looked at as being found more often in babies that are exposed to that THC during pregnancy.
Dr. Rodriguez has seen an increase of cannabis use during pregnancy since it was legalized in California.
You know, when something is legal, you think that it's okay. And that really, even though the legality of it has changed, really the science has not. We don't have any different data today that it's legal than we did 15 years ago when it was not legal. We see many patients that come in that have marijuana in their system, and they come in and deliver prematurely, or they may have separation of the placenta, and whether or not you can attribute it directly to the marijuana, it's hard to tell when you're just looking at the patient. But you know, if we don't see any other reason why those things are happening and the patient is positive for marijuana, you have to presume that maybe there was some link with it.
The strength of marijuana now is much greater since being legalized.
In the past, marijuana used to be grown widely, was not grown professionally, so there was only a small amount of THC, maybe 3, 4, 5% of THC in the compound that you were using. Now it's being grown professionally, and the amount of THC has been found to be as high as 25%, which means that it is much stronger. There's much more THC in the products that are being consumed today, and it is the THC that can do harm to the brain. So we're very concerned about the effect that it's going to have on the babies of mothers who smoke it.
Coming next, the help available for people suffering with hypochondria.